So this one's not the best news. I'm warning you. More than 1 million people were dropped from Medicaid. Okay, and that's because states started doing some purging after the pandemic. The pandemic's over, so now it's time to get rid of some people that, I guess need to get their own health care. So more than 1 million people have been dropped from Medicaid in the past couple months as a lot of states moved real swiftly to get their health care coverage stopped. Most of them got dropped because they didn't fill out paperwork or didn't fill it out correctly. And the eligibility review is required by the federal government. Our current administration is not very pleased at how efficiently some of these states have been accomplishing this task. They're pushing through these things, they're rushing it, and it will lead to eligible people, kids, families, they lose coverage. Okay, and for any period of time, losing coverage is scary, dangerous. It could really affect you, and it could ruin your life. It could end your life if you can't get life-saving care that you need. Obviously, losing it for any period of time is going to be a big deal. But some of these states are working so quickly that there's no way we can stop or we can prevent that gap, that gap that absolutely can end in lives lost, lives ruined. We know that it will. So about 1.5 million people have already been removed from Medicaid. So let's see, Florida dropped several 100,000 people, by far the most among all these states. I know you're shocked to hear Florida would be big on this. So there were a bunch that were decided in May. So we lost a whole bunch in Arkansas, Idaho, Kansas, Nevada, New Hampshire, Oklahoma, South Dakota, Utah, and West Virginia. That's weird. I wonder what all those states have in common. I don't know. I can't figure it out. Arkansas dropped more than 140,000 people from Medicaid. So now, I just want to say this. We are the last first world country that doesn't take care of its citizens in this manner. We're the last. I know that we tend to gather some good doctors over here, and I wonder if anybody bothers to think that maybe it's possible that the reason these doctors want to work here is because we don't have the kind of constraints that they have in other countries. You can charge whatever you want. In fact, because insurance works the way it works, they're incentivized to let you keep increasing prices, which then causes you to increase prices. And everything just keeps scrolling up. And who cares if people can pay for it or not? A lot of people's jobs are going to pay for it. And then if you can't pay for it, you've just got tens of thousands of dollars worth of bills from a hospital. Okay, you can work on paying that for your whole life. It's pretty sick. And I don't understand why we haven't decided that it's sick and we need to take care of people. But we clearly have not. So I just want to say that, Arkansas officials, they've talked about this. They said that they tried to renew coverage automatically for as many people as possible. They've placed a special emphasis on reaching families with children. But a 2021 state law requires the post-pandemic eligibility redeterminations to be completed in 6 months. And the state will continue to swiftly disenroll individuals who are no longer eligible. Sarah Huckabee Sanders, which is, is Arkansas's governor. She's also, though the governor, just a terrible source of information, even on Arkansas. She says those who don't qualify for Medicaid are taking resources from those who need them. She said on Twitter last month, but the pandemic is over and we are leading the way back to normalcy, right? Normalcy is we just don't care about people. That's normal. And look, I understand we're not in a pandemic. We're not in an emergency situation anymore. I get it. I'm not even saying that these folks can't be removed from Medicaid or maybe even shouldn't be removed from Medicaid. Maybe they should. The idea that we're in some race to get them off the books is ridiculous. It's not necessary. We could give them time. We could give kind of everyone collective time to figure things out and get things moving and take care of themselves. We want people to take care of themselves, of course. But that doesn't mean we shouldn't be helping people with healthcare. And, I know that for most people watching this, that would probably seem obvious. But for the people making decisions, it's clearly not obvious. Not obvious enough, anyway.